Make Are you interested in building a career in the development and humanitarian sector? Then, Strategia Netherlands is the best option for you. We offer training solutions to the United Nations, governments, NGOs and other development organizations worldwide. Make your online application now for Diploma in Monitoring and Evaluation, Diploma in Grants Management, Diploma in Conflict Management, Diploma in Disaster Management, Diploma in Water Sanitation and Hygiene, and many more. The cost for diploma courses is 800 euros, while postgraduate courses cost 1,200 euros. Visit www.strategianetherlands.nl for more information.
Welcome everyone to today's webinar. My name is Charlotte Mwambui. I will be your moderator today, and I am glad to have all of you here today. And so I don't know where you're joining up from. Is it morning, afternoon, evening? I want to sincerely thank you for joining and welcoming you all. So even as we begin, we are going to introduce ourselves, and this is how I will ask ourselves. So going to name in the chat. No, don't unmute in Nairobi. Sector you're in. So you can also tell me what you prefer. Is it qualitative, quantitative, or both?
videos razio. Ma raise hand wako. सही दीजिए सही देता सुरेश कैसे प्लीज
Hi Charlotte, we can't hear you.
All right, sorry. So I'm saying you introduce us in the chat, your name, where you are joining us from, how many years of experience in M&E you have, say 12 years, 5 years, 1 year. You tell us your sector. Are you in education? Are you in health? Are you in humanitarian? And then you tell us what you prefer. Is it qualitative, quantitative, or both, in that order in the chat. I will be reading them. So I would like to see that as I continue welcoming you all. I would like to see your name. For instance, it will look like something like Charlotte, William Guy, Tuongyok. So in that name, where you are joining us from, years of experience, sector, like that. Most of you are just putting in your name. I would love to see everything so that you can have a glimpse of who we have. Okay, I'm seeing something there. Barriers of Vishan from Pakistan, been working in M&E for 12 years, good. DRR and climate change adaptation, very nice. Welcome, Darira. We are seeing Hastings McLean from Malawi. Mohammed Abdelnabi, 10 years from the UK. Programs Director, interested in analysis. Interesting. You're welcome. Emmanuel Ladu from Torit, South Sudan. Nice, welcome. Innocent Orishaba, graduate of M&E in 2021 from Uganda, currently working in Ministry of Local Government. Welcome, Innocent. Nice to have you here. Afghanistan, this is Muhammad Farouk, 20 years experience in M&E. Wow, that's nice. Kim, Johannesburg, 3 years. mostly education, mixed methods, both qualitative and quantitative. Nice. We are seeing Loul Mefsin from Ethiopia. Amasegenalu, welcome. 7 years and in law. Nice. Ryan from Lebanon, Michael Nyundo, all of you, you are so welcome to today's webinar. Rashid, Pakistan Health Sector, 10 years of experience. Nice. Ibrahim Farah Natasha Mudalia from Fiji, 12 years in education sector, mixed methods. Nice, nice. I'm seeing all of them. I may not be able to read all of them. You will pardon me, but as long as I come across yours, I'll be able to read. I'm seeing Marvelous Daniels, Philippines, 2 years, DRM and CCA. Interesting. 8 years, I'm seeing 7 years experience. I prefer quantitative. All right, nice. Okay, I'm seeing Iraq. I am seeing Sudan, 2 years in M&E. Okay, so at least we can have a glimpse of who we have in the panel, in the session. 16 years, quantitative is preferred. Education sector from Ghana, Kosipa. Welcome, 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 everybody. Welcome, everybody. I wouldn't want to take most of your time. I would encourage you to put your questions, even as we start. You have gone through the poster. You have seen that today we are going to look at a bit of, the differentiate between monitoring and evaluation. We are going to look at the principles of M&D. We are going to look at the M&D strategies, systems, and frameworks, among other things. So I would encourage you, as we continue, kindly, put in your questions in the chat below so that I can be able to pick them up for the Q&A, which is going to be at the end of the webinar. Okay, yes, I'm seeing all of you. I'm seeing 5 years experience from Iraq. Thank you so much, everyone, and welcome from wherever you're joining us from. As you can tell, it's a whole international team that is here, and we are ready. As we wind up in that, you can drop in your emojis on how you feel about the session. I will be going through those. I want to see how excited you are about the session. Drop in those emojis. I can still see where you're joining us from. Thank you so much. Without further ado, I would like to welcome our facilitator for the day, for this session, who is our very own Dr. Joyce Wangari Ngugi, whom we have been having taking us through M&D in the previous webinars, if you have been able to join the previous webinars. She is an M&D specialist. She's a consultant and psychologist and a research mentor. Okay, so she's an associate director at Guira Communication Foundation. And if you want to know more about her, you can find her work in the social media. You can find her, you can Google her, and you can always tell her. We are privileged to have her here today to be able to take us through this masterclass, M&D masterclass. So I will encourage you to take on those notes, be ready, welcome, and be informed even as we continue. Dr. Joyce, welcome.
Thank you so much, Charlotte. Always a pleasure to work with you and all the colleagues at Strategia Netherlands. I can see colleagues, I see friends, I see people whom we are meeting for the first time. It's always really an honor to facilitate these webinars. This should be my 9th webinar, but 10th overall training. We did have an in-person training for those who had requested sometime in the last week of June at Nairobi. That's where I'm based, in Nairobi, Kenya, East Africa. I can see we have a full house from all over the world. I can still see more intros coming. Keep them coming. Lots of claps, lots of people saying hi. And we always are very privileged to have you joining us for this short 1 hour. So, of course, I have been facilitating different topics, but today's topic is on basics. We are assuming that we can go back to the beginner's level. And even those of you who had years of experience, you bear with us, because today's topic is particularly targeted for people who have never experienced anything to do with M&E. And as usual, before we start, I'm always happy to share past webinars in the chat for the sessions I've done. These are the same webinars you can find in the YouTube channel. We do have a YouTube channel for Strategia Netherlands. A lot of you, when you don't make it for the whole webinar, you're always asking. So I've just posted that in the chat for the sake of those people who have maybe not seen our YouTube channel, Strategia Netherlands. So do check out webinars I've done. They are titled very well, and you'll see the ones I've done have Dr. Wangari in the title. That makes it easier for you to locate them. And of course, there are many other people who have done webinars, not just me. It's a whole, good mix there in the YouTube. So not only subscribe, but also like, follow, and share. And most importantly, apply the training. Now, I'm also going to share the slides for today. People always ask for a copy of the slides, and I will graciously do that. We are in the 21st century, whereby the learning design is called, mutual. And in adult learning, we are all experts. We are here to learn from each other. I'll be happy to hear a lot more about your experiences as we go along. So feel free to type in the chat at any time regarding any questions or comments you might have. So I hope you can now see the slides that I have posted there. All right, so in that case now, I'm going to just share screen for my presentation. Yep, so that's that last slide where all my past trainings have been, but I'm just going to go to the beginning right now. All right, so of course, as you all saw from the poster, that this is an introductory beginner's masterclass. I have done another masterclass like this before, but this one had really specific objectives. Sampling some of your examples. I have a couple of examples, and not for any particular interest, but because these are focus areas for the Global South, we'll talk about some of the wonderful work you're doing. This is a targeted audience of humanitarian professionals. I know a lot of you are interested in working in NGOs or have been working in NGOs. And so practical examples would be great. So anything around refugees, WASH, which is water and sanitation, hygiene, and food security, among other areas. My core specialization is psychology. I am a trained psychologist. So I'm doing a lot of M&E work in programs which are under health sector. But psychology also happens to be in human development and in the wider social development space. So I do consider myself a social entrepreneur as well. So just a little bit more about my experience. I am trained and certified in monitoring and evaluation. I am not just a researcher. I prefer to call myself a knowledge co-creator. I do a lot of investigative methodologies, combining both quantitative and qualitative. And it is good, Charlene, that you asked at the beginning which methodologies people are interested in. And I could see there was a mixed bag. A lot of us were talking about quantitative. A few people said they prefer mixed methodology. That's actually my specialization. And I do a lot of data-driven storytelling and ethics. And most of my work now has gone into, the background work of supporting, training, capacity building, and mentoring the next generation of humanitarian professionals. So, of course, under Strategia Netherlands, I've done, like I said, about 9 trainings on research methods, M&E. The last one was on AI. I'm sure I can see some of you attended the one on AI. It was really fun. And then reporting and presentation is also another pet subject of mine. But aside from M&E work, I am involved in complex research communication, what we call, research communication, editorial ethics, and science reporting at the moment. Also trying to translate my own doctoral dissertation, which is at 233 pages, into some more popular press and ways that are understandable in the normal population. But I have been in the field for about 19 years, and I also run the largest network for jobs in mental health in Kenya since the year 2020. So our objectives are on the poster. There are 5. We're going to differentiate between monitoring and evaluation. We will understand the key M&E principles in humanitarian work. We will design M&E systems and frameworks, apply effective monitoring or end tools in the field, and learn from case studies, as I said, in selected fields. And I'll be happy to hear from you about other fields as well. So of course, we'll be looking at those key concepts, the core principles, which are really important. They guide us. These are ethical standards, some rapid examples, and some group activity. Then we'll do a wrap up. So I'd like you to quickly type in the chat one word you associate with M&E. So that's the first question. Try to put number 1 there because there are 2 questions. So what is one word you associate with M&E if you would use an analogy or a metaphor? Okay. So for me, I find M&E like a sieve. I'm able to filter, a lot of things. So that's my one word. What is yours? Please type in the chat. And then, has any of you done M&E work before? I'm sure most of you have, because you've mentioned you have years of experience. What is a challenge you have faced? So this is a self-reflection question. And I'd like to see in the chat if we have any responses. Okay, I can see lots of responses. Oh my goodness, the chat box is ablaze. This is wonderful, fantastic.
We have a lot of results, impact, tracking, evidence, investigation, mirror, knowledge, progress, lots of tracking there, targets, direction, data, evidence, impact. Yeah.
Wonderful. All those words are actually almost like synonyms of M&E, and that's very well done. This is a work group. I see you understand what we are saying. One has stood out for me, though, the one who said mirror. That's very interesting. I never thought of M&E as a mirror, but tracking, targets, those are very common words that we use in the field. So thank you so much for sharing. Keep them coming. It's always a pleasure to read them. Anyone, has anybody shared a challenge they had recently doing M&E work? Let me also request you, Charlotte, to check for me.
So there's one challenge when people think that M&E is not taker or a policeman.
Aha, yes. Yes. And someone said behavioral change is hard to measure. I totally agree. In my field of psychology, we do have assessment tools. Most of them are clinically subjective, but on a population level, I see how that would be a challenge. How do you know that, people's attitude, for example, has shifted as an outcome? That's usually a common outcome.
That's another challenge.
Yep.
Not many challenges coming in through.
Okay. Yeah, I'm seeing a lot of people talking about limited capacity, resources, poor responses. Yeah, but that idea that we are seen as police or, we are here to enforce rules is very common. We are seen as big managers when we do M&E work. Because of course, in the global south, most of projects in many development fields are donor funded. That is our current reality. And most of the countries in the global south, Kenya included, where I come from, are riddled with debt. So we have a lot of donor over-dependency, I think. So thank you.
There's a challenge on that.
Yeah, what did people say?
Budgets, especially during proposal writing.
Yes. Yes, those proposals can be quite technical, and most of the tenders and bidding are quite complex for most of us. Yeah, that's a challenge. Thank you for sharing. All right, so let's look at all the synonyms that have been used more recently or commonly. And people will always exclaim because it's not just M&E that exists, there's all these others. Why do all these synonyms exist? It's because there are different types based on purpose, forecast, timing, and audience. So I'm sure you've heard of MIL. MIL is a very, very popular one. MIL is monitoring, evaluation, assessment, and learning. Another very popular one, probably you've heard of, is results-based management, RBM. Okay. So you'll find that aspects of monitoring and evaluation can be highlighted in programs, and the naming systems in different countries or, spaces are, something interesting that you can take time maybe for your bonus exercise. Also look up related terms. Okay. So also around M&E, we have related terminologies like research, accountability, learning. Learning is used a lot nowadays. M&E is not just hanging, there's also learning always appended to it. Because after we've done all this monitoring and evaluation, we do want to take lessons, right? Appraisals, which is slightly outside M&E, but it is about management, okay? When we are monitoring, we do performance appraisals. A lot of you who are employed, you're hired, you have to fill in some appraisals every year, right? Reporting, management, those are other words that are also related to M&E, but are not in the core of M&E proper. So here is the definition that we can go with today. Monitoring is the routine, systemic, or systematic and continuous process of collecting and analyzing data or information to track progress and assess how well a project is being implemented. For example, many development projects across a large area want to track how many households have received assistance. Okay. However, evaluation is the systematic and objective assessment of an ongoing or completed project, program, or policy, its design, implementation, and results. For example, the effectiveness and relevance of a project. So you can see the difference is subtle. They are related, interrelated. Some people try to use the words interchangeably, but these are really distinct terminologies. Let's distinguish them some more. So in monitoring, you have a continuous tracking of activities. However, in evaluation, it's a periodic assessment of outcomes. You can have a mid-evaluation and an end evaluation. So in a refugee camp, water and sanitation and hygiene program, field officers track daily latrine usage and soap distribution. As you know, some African countries, for example, Kenya, host large populations of refugees, and having decent, dignified toilets has been a major challenge. So we can have an M&E program just to check, how soap distribution is inside a refugee camp. And what will be the evaluation? So for example, a question will be, did improved access to water and sanitation hygiene reduce disease outbreaks over 6 months? So we are able to use data about soap and latrine usage to check whether the diseases have reduced, increased, or are constant, okay? So that's evaluation. I hope that's now pretty clear. Now, this part will be really interesting because I also want you to type in the chat, think through the principles. These are just a few of the topmost principles that we use in humanitarian work inside monitoring and evaluation. So the first core principle is do no harm or non-maleficence. Now, non-maleficence means avoid as much as possible and at all times unintended negative impacts. So obviously, we've got to have a humane Ubuntu and Utu kind of monitoring and evaluation program whereby the human being is not under any risk of harm. Number 2, participation. So a lot of the times in M&E, you find that the program officer doing M&E is the link between the donor and the communities. Do we always sufficiently involve affected communities? And would we use a bottom-up approach when doing M&E? Some participatory methodologies, such as qualitative, enable us to do exactly that. We bring to the core a lot of the peripheral stories of people as they are affected in more marginalized contexts. Number 3 is accountability. This one is really important. And we call it accountability to affected populations. It is pretty obvious that in M&E, we've got to be accountable. However, what we know recently with the executive orders and the Trump funding cuts is that we have really been struggling as NGOs. I know all of you have a story or you know of someone who has worked in an NGO that was cut down to size, and therefore accountability for ongoing projects was left hanging. And in essence, there was no accountability because the funding was quite severe and abrupt. And so That I know has been a major challenge for most of us. Then we talk about transparency as number 4. That means sharing the findings with communities. Now, this part is very tricky. There is some information that is proprietary, and we've seen communities very empowered. Some of them will tear into the offices in the M&E and will require or demand certain information from organizations. So how transparent can we be, really? If we know someone has HIV and suddenly there's no more money for funding the medication, how exactly do we share these findings? That's just an example. The last one is real-time learning. So especially because of technology and AI, I've seen one of you requesting for us to do another or repeat the last webinar on AI. We are not likely to repeat. We'll probably add another angle, and so that we can continue learning together. Technology, AI has enabled that rapid learning. So I'm just going to give you a quick example, and I'd like you to type in the chat. You only have to pick one principle and say why you selected it. So this is the example. In one of the food distribution programs in Somalia, it's just an example. Community feedback boxes identified issues of unfair ration sharing. This led to adjusting the distribution strategy within 2 weeks. Okay, so there was food being distributed, but it was not fair. That got redistributed. In 2 weeks, that got changed. Now, which principle, if you can just pick the topmost principle, do you think was applied in this case, where the feedback about the boxes being distributed of food not being fair prompted quick action? Now, let's see, we are going to get a diversity of views. Moderator, you can help me to read in the chat. So just pick one, the topmost. I want to see if you can argue your case and just tell.
So there's a lot of transparency and accountability coming in.
Okay. Most people are saying transparency, accountability.
Then there's
And
real-time.
accountability.
Yes, AAP, yes, accountability. Wow, accountability. Accountability is coming in a lot.
Okay. Someone's already asking, Jackie,
Yes.
asking, with the core principles, how do you handle gatekeepers? Oh, that's an excellent question. I think I'll have time to simmer over it. We can all think about it. There's a lot of gatekeeping, I agree. A lot of gatekeeping, starting from global north, global south disparities. And so, I mean, there's people, including community leaders, who determine like who gets which food, and there's like power differences along gender, you know, all kinds of different things in many communities, not just in Somalia. So yeah. So I guess that is not an easy question. That's a food for thought question. Jackie Moikali, thank you for that. Gatekeepers, because we do need community leaders to help distribute the food, but then they're the ones maybe bringing the unfairness. Maybe they're the ones taking more food to one side and others are hungry. And so that's always problematic, always problematic. So maybe you can suggest some answers for that. But only a few people described. I said you say the principle and why. Only a few people say the reason. So Margaret said, number one, just doing no harm. They did not try to get more info. Yes, thank you for explaining. Other people did not follow instructions. They did not explain the reason.
Accountability, because the community is affected and the NGO has to be accountable.
Okay. Moses Moreko, I said you pick one. If it was a lottery, you have to just pick one. All right. So yeah, I can see a lot of you thought the main, most highlighted principle is accountability. And I'm dwelling a little bit on this slide because everything we do must be coming from a value system. So most of the problems in M&D work have been extractive, very extractive. You know, we have now a very well-established word about NGOism, whereby we cycle problems and people are still left in abject poverty after a program has come into a community and there is M&D. So sometimes it is not always the case that people are left empowered at the end of a program. That's why we always have to think about our values and principles all the time. Thank you for all your sharing. It was fantastic. If you have a question, maybe put it in the Q&A so it'll be easier to sort them. So let's take some examples now. We have the program cycle, and these are very important slide in M&E. We talk about the M&E program cycle. It starts with a needs assessment. First, we want to do a multi-sectoral assessment. For example, if it's a refugee program in the different settlements, you might find unique contextual needs in different corners. Then number two, we want to design. There's something called a log frame. Today, we don't have time to have the visual display and step by step, but I'll be talking about it in an overview. But those of you who are coming in to an M&E class for the first time, then you will be dwelling on log frames a lot. There's a lot of visual material where you get to develop and design a log frame for a protection program for unaccompanied minors, for example. In refugee populations, you'll find a lot of children who have not been united with their parents, okay? So you have to map out how to protect those children. Then monitoring. So typically the duration is weekly. We'll be tracking the cases and referrals. And then evaluation can be done midterm and even at the end. In midterm, you can assess the effectiveness of, for example, psychosocial support. And at the end, you have a learning where now you take all the lessons learned and feedback, and you use that to adjust the program design. So if this was in a pictorial format, there would be an arrow going back to number one. So this is always in a cycle. It's always going round. And from the learning, that helps create the next needs assessment. So there's a top-down element and a bottom-up element always. Let's look at a WASH example. For example, emergency intervention in flood-affected areas. So in M&E work, we talk about things called indicators, the outputs and the outcomes, and those are slightly different. In outputs, we're talking about some tangible numbers, for example, percentage of households with access to clean water. In outcomes, we might be talking about a state, for example, percentage reduction in reported diarrhea cases, or we're having healthier children. That's an outcome. Some tools we can use. I know some of you really wanted to know examples of M&E tools, like Kobo Toolbox, and I put the link at the end. You can always just Google it, and it has a lot of information on their website because the most versatile of all the tools are mobile surveys. All of us mostly now have a smartphone. And so water testing kits are also tools that are used. We are able to test if the water is pure and clean so that it's not causing diarrhea, for example. Community health feedback is a tool. And that could be a semi-structured interview, more qualitative one, or a survey with Likert type responses. That's more quantitative. And then when we're designing the systems, we always have to think about challenges ahead of time and potential solutions. For example, how would we do remote monitoring? Remember, in flood-affected areas, we are cut off, including from physically accessing the spaces. So then how would we ensure data quality assurance? That's where really technology comes in. For example, using SMS, the short messaging system on the phones, for data submission, and using local volunteers who are trained. So there's a lot of capacity building for people who are right at the community level in order to feed the M&E program systems. Let's look at another example, for example, food security. If we would like to do a results-based management framework, so the project would be titled Cash for Food Program in a conflict zone. As you know, a lot of the conflict-ridden areas in, for example, sub-Saharan Africa have problems with accessing affordable food because when people are fighting, at that point, the farms are being burned and people are not getting, households are not getting enough to eat. So in M&E, there's another concept called theory of change. Now, theory of change is a really easy statement that all of us can design. We use the formula of if, then, okay? So theory of change is an assumption we make when we are designing M&E frameworks. So here's the example about food security. if households receive monthly cash transfers, they can buy enough food. Now, the arrow can be replaced with the word then, okay? So if households receive monthly cash transfers, they buy enough food, then what would that result in when people have enough food? They have improved dietary diversity, all right? And then they have reduced malnutrition. What you notice with food insecurity is even the rations that are given by food aid may not be very diverse. For example, it's easier to transport maybe dry grains and cereals, but it's not very easy to get fresh, fruits and vegetables. So you find that if people can have money in their hands, they buy enough food, they might be able to access fruits and vegetables. And so therefore, even cases of malnutrition go down. So that's an example of what we call a theory of change. Try to think of your own projects and just take a minute and type in the chat some examples of theory of change. So an evaluation question would be, did cash transfers actually lead to more nutritious food purchases? Okay. So after the assumption from your theory of change, you can now design an evaluation question. And we want to see if there is a resultant effect of the program on a certain outcome, a certain state of more nutritiousness or reduced malnutrition. So that's an example from food security. I hope you're all able to type your theory of change in the chat. So let me take another example on refugees. In this case, let's do a qualitative program with key informant interviews, also called KIIs, on refugee women about GBV services. So as you know, in a lot of sectors, there is gender-based violence. And we always want to map access to services. So in the case of quantity,
Dr. Wangari, we dropped you. Dr. Wangari. So keep on, as we wait for her to rejoin, kindly let's use the Q&A tab for us to raise our questions so that I do not lose track of your questions, because we will have the Q&A session at the end of the webinar. So let's utilize that function. And I hope we are all enjoying our session so far. So I am seeing questions asking about the previous webinars. The previous webinars can be found in our YouTube channel, Strategia Netherlands. You will find it there and you can be able to go through them. As for the slides, I believe once you have registered, your emails will be used to share the slides for the current presentation. So if you missed out on that, you can definitely just, send an email to the organization and they'll be able to, on a case by case basis, they can be able to do that. So some of the other questions, I'm seeing your questions, I will be able to raise them. Meanwhile, so for the connection, yes, I know we have lost Dr. Wangari. She will be joining us anytime now. I hope by now everyone could be able to see her presentation, because I was seeing some people saying that they could not see her presentation. All right, I'm seeing hands. Lydia Bali. Do you have a question? I'm seeing you raised your hand. You can unmute and say, Okay, so Regina, kindly unmute Regina Baribari. Let me see. So that you can be able to tell us what questions you have. Martin Cheriot, go ahead and tell us what question you have. Martin Cheriot. Did I? Martin Cheriot, I've asked you to unmute. You can talk to us. Okay, maybe. Yes. Did you have a question? Yes,
No, I
hello.
don't have a question, but in case I have, I will ask it at the end of
Because I saw you had raised your hand.
no, maybe
All
that
right.
was by mistake.
Okay.
Thank you.
Thank you. All right. I hope those who have raised their hands had questions. As we wait for Dr. Wangari to join in, I apologize for that. You can lower your hand if you don't have a question. I'm getting your questions. Those who are using the Q&A tab, I'm seeing your questions, and we will be answering them towards the end of the session, and we will be having a Q&A. I'm seeing you drop your emails. We already have track of your emails so long as you've registered. There's no need of sending your emails here. So long as you have registered, we have track of your emails, and we will be able to send the presentation to you. Thank you. So let me use this opportunity to welcome Doreen, our colleague from Strategia Netherlands, who will be able to take us through something even as we continue. Doreen, welcome.
Thank you, Charlotte. Hello, everyone. Good evening, good morning, good afternoon from wherever you are. My name is Doreen. Thank you for joining us today in this webinar. Feel welcome. Mine is just to take you through who we are and what we do here at Strategia Netherlands. So I will start by who we are. So Strategia Netherlands is an international capacity building and training organization. And our mission is to make development effective by delivering high quality consultancy services and providing innovative training and learning programs to NGOs, to government, and many other developing organizations or development organizations. So from here, I'm going to talk about our programs. When we talk about our programs, we offer them in 3 levels. That is, we have a postgraduate diploma, we have a diploma, and we have certificate. We also have short courses that at the end, we offer certificates. When you talk about the postgraduate diploma, this one takes a duration of 12 months. Sorry for that, doctor. Okay, so I was talking about the postgraduate diploma. This one takes a duration of 12 months. During these 12 months, you are able to do 8 modules. We have 8 assignments. We have a research paper and a final exam. For the postgraduate diploma, it goes for 1,500 euros. But for everyone who has joined the webinar today, we have a 20% discount for you. So keep your emails coming at info@strategianetherlands.nl. Then we have the diploma courses. The diploma goes for a duration or runs for a duration of 6 months. And during this period, you are able to cover 6 modules. We have 6 assignments. We have one final exam and 1 research paper. For the diploma, it goes for a course fee of 1,000 euros. But for everyone who has joined us today, you will be able to get a discount of 20%. So that lowers the course fee from 1,000 to 800 euros. Then we have the certificate courses. For the certificate courses, we run them for 3 months. And during this time, you are able to cover 3 modules. Then we have 3 assignments and a final exam. The certificate goes for a course fee of 500 euros. With a discount of 20%, you get to pay 400 euros. We also have short courses. These short courses, the duration depends on the course that you choose. So we have some of them that go for 6 weeks, others that go for a period of 8 weeks. And during this time, because we are offering certificates, you will as well complete 3 modules. And then we have 3 assignments and a final exam. Then at the end, you get a certificate as well. At Strategia Netherlands, we have a team, and our team consists of well-trained managers. We have lecturers who are equipped with PhDs, others have doctorates. Then we have our lecturers also equipped with master's degrees. So whenever you are enrolling for these courses, be sure that you are going to come out here well equipped with all the professional needs, and our certificates or the diplomas, the postgraduate diplomas are well recognized all over the world. So when you join us, be sure that you're going to get something that is well recognized all over the world. We also offer on-site workshops. And when we talk about the workshops, these workshops run for 4 days. And the training fee for the workshops is 2,000 euros. With the 20%, each training is going to go for a charge of 1,600 euros. That is for the people who have joined us today for the webinar. So you can register for the workshops. We have many that are coming up on November and December. We have many that are coming up. You can visit our website, that is www.strategianetherlands.nl, and you will get more information on this. Or you can send us an email to info@strategianetherlands.nl, and we'll be able to guide you all through. So thank you all for joining us today. We are very delighted. For this and more information, you can visit our website. You can also follow us. We have other social platforms. You can also follow us at LinkedIn. Our social media page is Strategia Netherlands. We also have a Facebook page, Strategia Netherlands, and we also have a YouTube channel. That is where you will be able to get the recording of this webinar and other webinars that you have been doing. At Strategia Netherlands, we believe that building skills and strengthening capacity is the foundation for lasting change in humanitarian and development work. Thank you all for taking the time to join this webinar. We appreciate your time and your engagement. Thank you.
Thank you so much, Doreen, for that. So that is basically to tell all of us that we have these humanitarian courses, and you're all welcome to register so that you can be able to learn more. This is just a masterclass where we just introduce, but you can get to learn more and engage with the qualified facilitators from those courses. Dr. Wangari is back. Welcome, Dr. Wangari. Yes, you can proceed.
Yeah, so because we have run out of time, what I'll try to request now is to take a couple of questions. I was just going to wind up the presentation. The case studies, you can do them on your own. It is very good practice for us to think through what the different, scenarios would be, and including what you would do to improve each of the programs. So I think instead of going into the case studies, in the interest of time, I'll take questions instead. And just to wrap up my presentation, I don't know which slide you can see because there's something else that's come up on my screen. Is to say that final thoughts, we have to balance rigor, methodological rigor, which means we really have to do excellent M&E with the flexibility of how there's a lot of uncertainty and that our communities might introduce changes into the initial program design coming straight from the donors or the funders. So our M&E must be flexible, people-centered, and data-informed. And that's not usually a very easy balance for most of us. But how do we do that? We have to keep listening, adapting, meaning changing and acting on the evidence. So your role is to really bridge the data and the action for better outcomes. And obviously, you need to listen to feedback in order to change the outcomes of your ongoing projects. So I'm just very curious. I'll draw a question to the audience. What is one thing from today you'll take back to your team? And what can you apply these lessons? How can you apply these lessons in your own context? So please type in the chat your lessons learned. And that is my final closing thought. I'm now happy to take a couple of questions. I've already told you the resources that are at the end of the slides. The link I have shared in the chat. And I'd already given you my past training slides links. So, okay, let me take one or two questions before the top of the hour. Thank you.
So, Dr. Wangari, we have quite a number of questions. So one was, what came earlier was, first of all, is there a body for registration where we can have M&E professionals in one place where they can share knowledge?
That's a really good question. Yes, I saw that question. It was asked quite early. And obviously, nowadays with technology, you can start a group as fast as possible with just a WhatsApp group link. Of course, there are associations that are more established. And I think based on your country and whether you want a more global focused or regional focused, you can also find M&E associations that are issue focused. For example, we have gender specific or gender M&E kinds of associations and programs. It's all a click of the button. Please Google and find spaces of interest. Also feel free to start your own movements. I like that question because it's opening up the space for peers to think and interact. One of my most favorite things is just the Google Workspace. With a Google Doc, we can start collaborating in real time with people across the world. So feel free to also do your own bottom-up organizing and get a community of people based on the needs that you've identified, or you can join the more established ones. Thank you.
Thank you. So we have, how do you monitor a pool-funded project?
Yeah, that's a very interesting question. Mostly because of GDPR, that's the Global Data Protection Regulations. We found more stringent regulations from donors in the global north towards the global south. And so when you're doing monitoring and evaluation of donor-funded projects, and with all the complexities, like I said earlier, it is important to keep having stakeholder meetings. So the solution is really in keeping on reactivating conversations with different players, stakeholders, and updating everyone on any bottlenecks and challenges. And of course, with gatekeepers, like, Jackie Mwikali had asked earlier, what makes it more complicated is even when we are in the offices designing these programs, we've got to make sure that the so-called gatekeepers or community leaders who are representing, the people on the ground are well selected. So that's the solution about gatekeeping, is to have like even a well-representative team of leadership, where if you need to roll out food in a community, that the people who, are representing the community to come and pick the food rations are people who are well trusted by the community. So it's all about iteration. If I put in one word, what all of that is about is the back and forth. We call it iterating. We always have to keep checking, improving, building back better each and every time. Thank you.
Thank you so much. So we have Jeremiah Ullah asking, given that monitoring is described as continuous data collection while evaluation is periodic assessment, how do the methodological approaches differ when measuring the same indicator?
Yeah, very, very good question. So all of them will use outcomes and outputs, and you'll find that there'll be bigger representation of outcomes in the evaluation because we want to see if the state has changed. So that's the main methodological difference when it comes down to the nitty-gritty, which is, of course, a different webinar, which we can do on a different day. That's why today I said I'm not opening up the log frame and all that. So as you say, most people confuse outcomes and outputs. You want to find, what tangible things are shifting over time, and then what states or conditions are being improved as a result of those tangible things that are shifting. So those tangible things are the outputs. And that is something that monitoring is very good at. And at evaluation stage, you want to check if a condition, a state, has improved or declined or remained constant. So that is an example. I can see resources being shared. I didn't want to market for any associations here. AgDen is a very, very popular one. AFREA, those are all based in Africa for those who are coming from sub-Saharan Africa. Thank you, Elizabeth Duko, for that. Yeah, any other last question as we finish?
So most of the questions are asking about which one comes first. Is it monitoring, evaluation, and some of the, some of the things which we have said. For some of these things, you will be able to learn once we enroll, so that you can go deeper into sharing the details. Also about the frameworks, which we have said this one we can learn in details, even as we continue delving deep into the monitoring and evaluation causes. There are several questions that are coming through. We may not be able to answer all of them. So if your question has not been answered, and probably you may need to probably enroll to the course, or you might reach out to us later, maybe through the website, so that you can be able to, try and answer your question, because time is not on our side. So I would like to thank everyone for coming in and joining us through this webinar. I believe that we have learned quite a lot. For those who are wondering about the website, the recordings are found in our website, in our YouTube channel. The presentation will be shared to you. The links have been sent also on the chat. Please keep those links so that you can be able to view the recording. Thank you, Dr. Wangari. Do you have any shots you would want to say?
I'm really honored to be here with the 275 plus, many more participants who joined us, and let us keep ablaze the monitoring and evaluation spirit. Thank you very much.
Thank you so much. I'm seeing your questions. We may not be able, as I have said, to mention because of time. However, we have encouraged what we need to do so that you can be able to answer all our questions. Remember, we are too many, we may not be able to do this right now. So thank you so much for joining us. You are welcome to join in the next webinars. Whenever they are ready, they will be communicated to your various platforms. I think this is my time to say goodbye and see you again soon. Thank you so much.
Are you interested in building a career in the development and humanitarian sector? Then, Strategia Netherlands is the best option for you. We offer training solutions to the United Nations, governments, NGOs and other development organizations worldwide. Make your online application now for Diploma in Monitoring and Evaluation, Diploma in Grants Management, Diploma in Conflict Management, Diploma in Disaster Management, Diploma in Water Sanitation and Hygiene, and many more. The cost for diploma courses is 800 euros, while postgraduate courses cost 1,200 euros. Visit www.strategianetherlands.nl for more information. Are you interested in building a career in the development and humanitarian sector? Then Strategia Netherlands is the best option for you. We offer training solutions to the United Nations, governments, NGOs and other development organizations worldwide. Make your online application now for Diploma in Monitoring and Evaluation, Diploma in Grants Management, Diploma in Conflict Management, Diploma in Disaster Management, Diploma in Water Sanitation and Hygiene, and many more. The cost for diploma courses is 800 euros, while postgraduate courses cost 1,200 euros. Visit www.strategianetherlands.nl for more information.